question says that the doctor orders Tylenol suppository 1 gram PR every 6 hours, PRN, a fever greater than 101. All right, it says that the Tylenol suppository is available in 325 milligrams. All right, so it says how many suppositories will you administer? So we know we're asking for a suppository, so we're just going to write that to the side. All right, so what I like to do is I like to start with the physician order. So the physician orders 1 gram. Okay, well, we know grams have to cancel out because our answer needs to be in suppository. So when we go to our problems, look, we see no grams, we see milligrams, so we have to convert. So we know that 1 gram is 1,000 milligrams. So then our grams cancel out and we're left with milligrams, but our answer needs to be in suppository. So our problem says that the suppository, 1 suppository is 325 milligrams. So we're going to put 325 milligrams on the bottom because milligrams is on the top over here. And then we're going to put 1 suppository on top. All right, so our milligrams is going to cancel out and we're going to be left with suppository. So all we have to do is multiply straight across. So we just have 1 times 1,000, which is 1,000. And then we have 1 times 325, which is 325. And then we're just going to divide that. And then you should get, so 1,000 divided by 325. That's going to give you 3.0769. But we can't give a point of a suppository, so we're going to round it to our nearest whole number, and that's going to be 3 suppositories. So I hope you guys got that one correct. The question says that the doctor orders nefacillin 500 milligrams PO/PC. It says this medication is supplied in 1 gram per tablet. So it says how many tablets will you administer per day? So first let's start with the physician's order. So we know we need to be in tablets. All right, so the physician order is 500 milligrams. So we know milligrams need to cancel out, but when we look at our problem, we don't see milligrams, we see grams. So we'll have to convert. So we know that if milligrams is on the top, milligrams need to be on the bottom. So we know that 1,000 milligrams is equal to 1 gram. All right. So milligrams cancel out. We're left with grams, but our answer isn't asking for grams. Our answer is asking for tabs. So your problem says that there is 1 gram per tablet. Okay, so grams go on the bottom. 1 gram go on the bottom because gram is on the top there. And 1 tablet just goes on the top. So grams cancel out and we're left with tabs. All right, so all we have to do now is multiply straight across. So 500 times 1 is 500. And then on the bottom, we got 1,000 times 1 is 1,000. So we do that. 500 divided by 1,000 and we'll get 0.5. Now, are we done? No, we are not done because this is per dose. The question asks, how much will the patient receive per day? So we go back to the physician's order and we see that it says 500 milligrams PO/PC. PC means after meals. So in NCLEX world, the patient is only eating 3 times a day. So that's breakfast, lunch, and dinner. So that's 3 times. So we're going to take 0.5 and times that by 3. And then we're going to get 1.5 tabs. So the patient is going to get 1.5 tabs a day. So that's going to be your answer. So just make sure that you're always paying attention to if it's asking per day or per dose. If the question said per dose, then it would just be left at a half a tab per dose. But since it's asking per day, they're going to get 1.5 tabs per day. The question says that the doctor orders Synthroid 75 mcgs PO daily. And it says what you have available is Synthroid in 0.15 milligram tablets, and it's scored. And it says how many tablets will you administer? All right, so let's start with the physician's order. So we have 75 mcgs. All right, so our answer needs to be in tab. So we know that mcgs need to cancel out. When we look at our problem, we don't have mcgs. So we know that we have to convert to get to what we have, and what we have is mgs. So we know that 1,000 mcgs is equal to 1 milligram. So our mcgs cancel out, and we're left with milligram. But our answer doesn't need to be in milligram. Our answer needs to be in tablets. So we got 0.15 milligrams, and we know milligrams need to go on the bottom because milligrams is on the top in order to cancel out. So remember, it has to be on the top and the bottom in order to cancel out. And we're going to put 1 tab on top because that's what it says right here. All right, so then our milligrams cancel out, and we're left with tablets. So now all we have to multiply is the top and the bottom. So the top, we're going to do 75 times 1. That's going to give us 75. And then on the bottom, we have 1,000 times 0.15, and that's going to give us 150. So we're going to do 75 divided by 150, and we should get 0.5 tablets. So we're just going to give this patient a half a tab. The question says the doctor orders Demerol 50 milligrams IV push every 6 hours PRN for pain. What you have is Demerol 75 milligrams per 1.3 mLs. How many mLs will you administer? So our answer needs to be in mLs. So let's start with the physician's order. So the physician's order is 50 milligrams. So we know milligrams has to go because our answer needs to be in mL. So let's look at our problem and see where can we get milligrams from. So we found some milligrams right here. So if milligrams is on the top, milligrams have to be on the bottom in order to cancel out. So we're going to put 75 milligrams on the bottom, and on the top we're going to put 1.3 mLs. All right, so milligrams then cancel out, and we're left with mL. So all we have to do now is multiply the top. So 50 times 1.3, and that's going to give us 65. And then we just have 75 on the bottom, so we just got 75. So 65 divided by 75, put that in your calculator, and you should get 0.86666. So you want to follow your directions and round to whatever your instructor tells you to round to. So for this problem, we're going to round to the nearest tenth. So our answer is going to be 0.9 mLs.